MBA Healthcare Leadership graduate who's going to help us with this discussion. Mia, very good afternoon to you, and thank you so much for joining us. We really do appreciate your time. Now, how does a breast cancer diagnosis impact an individual's ability to work, and what are some of the common challenges that are faced within the workplace?
Breast cancer affects millions of women worldwide, many of which are part of our workforce. And a breast cancer diagnosis is life-changing. It fills the patients with complex and conflicting emotions of fear, hope, and determination. The treatment schedule, the medical appointments, the physical side effects of the treatment disrupts both their personal life and work life, with consequences to their productivity, their job performance, and their career advancement, and ultimately their job security. The financial impact of the treatment is sometimes overwhelming. Some patients face financial ruin. And apart from these physical and financial threats, they also have to face the impact of psychological and emotional impacts.
Of course.
Yeah.
So just there, Mia, in your opinion, how aware are employers and other colleagues about the specific needs of employees that have been diagnosed with breast cancer? What misconceptions do you think exist?
Unfortunately, there are misperceptions about a person's ability to work during and after undergoing cancer treatment. And this puts patients at risk of unfair labor practices, such as demotions, being assigned to lower category functions without reasonable accommodations from the employer's side, and be receiving unfair performance appraisals, or just being sidelined by co-workers who don't understand what they are going through.
So are there any support systems that are currently in place for employees undergoing treatment for breast cancer? Are there specific policies that you believe are particularly effective?
Breast cancer patients receive protection from South African labour laws, as well as like the Employment Equity Act and your Code of Good Practice for Disabilities. And employers need to consult their legal departments or labour brokers to ensure that they understand what are their legal responsibilities and ensure that they comply with these labour laws. But it's generally about accommodating disabilities, preventing discrimination, and protecting privacy of these patients. And we have to inform our employees about their protections and provide them with the resources to understand what these mean.
And how important is that education and awareness for employees in terms of them knowing what the law provides for them in terms of protection when they do find themselves within these circumstances?
I think it is important for employers to understand what are their legal responsibilities. And as I said, they need to inform their employees about these protections. In terms of prevention of breast cancer and creating awareness, if employers participate in employer assistance programs, they can provide access to screening services very early and for the early detection of breast cancer. As we know, earlier diagnosis will improve disease management and create a better survival rate for these patients. And if we create awareness of breast cancer amongst our employees, it will enable them to support these individuals, these vulnerable individuals better.
All right, Mia Barnard, thank you so much for your time, and very insightful there, especially those who do have colleagues or who themselves are sitting with a diagnosis of breast cancer and having information in terms of what it is that they must do. Thank you so much for joining us and for your time.